This is our session on race, socioeconomics, and workplace mental health, and we've got a great panel here to talk about that with you. So we have Dr. Sabrina Taylor, who comes to us with both academic and clinical experience. She's the owner of Benefits Understood Counseling Services, which is a vocational rehab provider in Maryland. And she specializes in career coaching, women's issues, and racial identity, as well as a whole host of other things, which she can talk to you all about. Dr. Jason Wang, who is a vocational psychologist and also specializes in career-related issues and therapy. He especially has done research regarding a population we haven't talked about that much yet, which is unemployed, underemployed, and vicariously employed people, and so he can speak to that. And I know that someone had a question earlier about election stressors, and while that was not the intended topic of this session, he has also done work on that, so just as an FYI. And Sarah DeCosse, who is the Assistant Legal Counsel for the American Disabilities Act and the Genetic Non-Discrimination Act within the EEOC. She has a long history of human rights work, even before joining the EEOC, especially focused on disability rights. So please join me in welcoming this panel.
Good morning, everyone. I hope you all are well, and I am looking forward to speaking to you all this afternoon briefly. I bring you greetings from Benefits Understood Counseling Services, located in Columbia, Maryland, and also the Maryland Counseling Association. I am the president-elect. My term will begin in July, so very happy to be here to speak with you all about race, socioeconomic status within the workplace, and how individuals who have clinical mental health issues can be impacted within the workplace. So I'll talk to you a little bit about that briefly. Today, we're going to explore how racial and socioeconomic status influence mental health in the workplace, and I'm going to give you some strategies on how to create a more supportive work environment for all employees, whether they have they're from a different ethnicity, or they have a disability, whether it's a chronic mental health illness or a actual physical disability. One of my specialties that I work with is individuals who have visual impairments. So I am inundated every day with helping these individuals find jobs, but also helping them to get accommodations. So not only their physical needs are met, but their mental health and emotional needs are met on their job. So first, I'm going to talk about intersectionality. And mental health in the workplace is affected by various factors, again, including race and socioeconomic status. These elements often intersect, which creates unique challenges for these individuals. Research shows that people of color and those from lower socioeconomic backgrounds report higher levels of workplace stress and mental health issues. There was a study conducted by the American Psychology Association in 2017 that found that 44% of Black adults and 40% of Latino adults report significant stress at work compared to 30% of white adults. And so this can be due to discrimination and bias, where employees of color often face discrimination and bias, which leads to increased stress, anxiety, and depression. Also experiencing microaggressions, lack of representation within their leadership at work, and inequitable opportunities that contribute at times to a hostile work environment. So one of the case examples that was provided by this study with the American Psychological Association was that there was a Black employee who was consistently overlooked for promotions despite their qualifications. This individual was the only Black individual at this agency out of 25 employees, and everyone was being promoted. They were not being promoted. And so after an investigation, it all boiled down to race as a factor. And so this increased, mental health issues like anxiety going to work, spending a lot of time in the bathroom, crying before the workday, and, taking a lot of time off because of what they were feeling and experiencing while they were at work. Another issue that I want to talk about as it relates to impact, impact of socioeconomic status on workplace mental health is that employees from lower socioeconomic backgrounds often face financial stress that exacerbates their mental health. So if an individual is from a disadvantaged background, and they may be working, but their income, they still may meet poverty guidelines. It may be receiving Section 8. They may be receiving food stamps. In addition to that, they may be worried about how they're going to pay for daycare, or if I earn too much money, my benefits are going to get cut off and I'm not going to be able to provide financially for my children. I may lose my Medicaid. I'm only earning in Maryland minimum wage is $15 an hour. So imagine having two children, a spouse, and you're earning $15 an hour. You can't afford daycare. You can't afford insurance benefits without receiving government assistance. So these are issues that can impact their ability to be effective at work. They lose focus, they lose concentration, and also not having access to resources. Those in lower income jobs may not have insurance that covers their mental health care. So, you may be receiving certain government assistance type of insurance. But let's say that you need an assessment you have a child that needs to be assessed for autism. Well, if you're paying for one of these assessments out of pocket, they're $5,000. There are very few psychologists who accept Medicaid. And those that do, their wait list can be anywhere from 6 months to even 2 years in Maryland and in DC. And so thinking about not being able to get those assessments, being able to get the behavioral assistance you need, the medication assistance you need. These all impact the ability for, someone to be able to be effective at their job. So I promised you some strategies as it relates to being able to improve the workplace environment for all individuals that are employed at a company. So some of those strategies include creating an inclusive environment. So inclusivity in policies and procedures. That is re-examining if an individual needs to take time off after having a baby. And they may have other stressors that are going on within their life due to socioeconomic status, due to being from a disadvantaged background, such as having a disability. And so making sure that your policies are reflective and make sure that they are culturally appropriate to be able to best serve those employees. Organizations can promote mental health by fostering an inclusive culture, including diversity training, ensuring equitable opportunities. Many companies, if you're looking at promotion within a company, many companies do not have their promotion policy outlined. They do not have it in a written format. They may just say, you did very well, you had a successful quarter, you're going to get an increase. But someone else who may have worked just as hard and had a successful quarter, they may not get a promotion or they may not get an increase. So making sure that there are equitable measures as far as evaluations that are consistent and are the same and also are not culturally biased as well. As far as having support systems, it's very important for offices to have employee resource groups that are providing a sense of community and also a sense of safety within the workplace. I have done in the past a lot of diversity, equity, and inclusion trainings. And what I find is that, they say, yeah, we do these trainings all the time. We're an inclusive office. But what they yet or neglect to say is that they may have one or two people who are a person of color in this training program and the rest of the employees are white, and then they look to those two individuals to be the representative for everyone speaking or for the race. And that puts a lot of pressure on them. It creates anxiety. Many don't want to go, or they may call out sick because they do not want to sit through another training where they have to be the representative for their entire race. And so making sure that when we're having these trainings, that we're making sure that we are not putting our own cultural bias or putting a lot of pressure on those who are of color, making sure we're bringing in outside entities and actually being aware of the dynamics within the workplace culture. And then also, again, I just want to close out by saying in summary that race and socioeconomic status, it significantly impacts workplace mental health. I don't care if it's within education or if it's within healthcare or even within the counseling field. I tell everyone, I think Dr. Yang will agree with me, that most therapists, all of us have a therapist because we have to take care of our mental health. And we encourage that for our clients. And we want to make sure that we are taking care of ourselves so we can help those who are needing us to guide them on their journey. And so thank you very much for listening, and I'm looking forward to your questions at the end.
So I appreciate the kind introduction. I work with the Equal Employment Opportunity Commission. I'm in our policy shop, basically, and I lead our disability team. So I'm delighted to have you all here today. Congratulations on your fellowships. And we're very excited about what stories you're going to be writing in the coming months and years. So I'm going to what I've done is I've provided you more information than I'm going to cover in this presentation. I hope that it'll be useful to you. You can refer back to it. I've incorporated a ton of links in this presentation, which I understand you will all be receiving. So I'm not going to cover every slide, but you will have all of them as a resource in the future. And this is just a quick overview of what I'm going to be covering. This is where our offices are. This is just a very short history of the development of disability law in the states. I really want to focus on this. This is some two quotations from the legislative history for the Americans with Disabilities Act. And they really, I think, capture a recognition by Congress that was incorporated into the actual provisions of the law that disability can be extremely stigmatizing. And that oftentimes is what propels discrimination in the workplace. So not only was there that recognition, but there also were concrete steps taken within the law to protect from that kind of stigmatization. In particular, there are limitations in terms of disability-related inquiries that employers may make and their ability to require individuals to undergo medical examinations. Those are just two. But as you'll see, the issue of stigma, myths, fears, propelled simply by virtue of disability alone come up quite a lot. And of course, that appears to be a particularly important aspect to mental health. These are the laws we enforce. This, I thought, we literally just published these new data points this week. So this is I just selected a few so that you could see that in general, there has been a very significant rise in terms of the charges that we receive that are making allegations of discrimination in the workplace linked to mental health disabilities. And I provided you the link, so if you want to go explore, there's a ton of data there, you're welcome to do so. The question of what an ADA disability is somewhat complex. There are three different prongs of the ADA disability definition. The one that most people think of is the first that you see there, an actual disability. That's defined as a physical or mental impairment that substantially limits a major life activity, or with a 2008 change in the law, that concept of major life activity also includes a major bodily function. With respect to mental health, that would include, for example, brain function, neurological function. So in 2008, after a series of court decisions, including Supreme Court decisions that really narrowed the application of the disability laws to people with disabilities that pretty much everyone, including Congress, would recognize should have been covered by the ADA, Congress acted to amend the law and make the definition more clear. That was with the passage of the 2008 ADA Amendments Act. And I've highlighted a few of the provisions here that were intended to ensure that there would be broad coverage for people with disabilities. So whereas under the prior regulations issued by the EEOC, there was language like there needed to be a significant restriction or severity was considered, that is no longer the case. There does not need to be a severe, a permanent, a long-term substantial limitation. There can be temporary measures of a certain length, but the law now very clearly clarifies that many more people should be covered, including, of course, those with mental health disabilities. So these are some of the basic coverage areas, failure to hire, termination, terms and conditions of employment, including unequal pay, disability harassment. In the materials, we just published a very comprehensive enforcement guidance on harassment. I think it's beautifully written and super helpful. You have a link to that in your materials. And unfortunately, we do see disability-based harassment happening in the workplace. I cited a relatively recent resolution where a military vet with PTSD was allegedly repeatedly called by his supervisor a psycho in the workplace. And on the days when he had to go to receive his treatment for PTSD, that supervisor took to calling them Psycho Thursdays. We were able to resolve that matter successfully. But that kind of just flat out, pretty straight up harassment, unfortunately, continues to happen. Reasonable accommodations, we already heard a little bit about them. They can be incredibly valuable for people with disabilities, including mental health disabilities. Asking for one is super simple. There's no form you need to complete. There's no magic language you need to use. An individual can just indicate, I need a change because of an impairment or some other language along those lines. And that triggers an employer duty to consider possible reasonable accommodations. I've included an explanation of a number of things that are not required as reasonable accommodations, and I'll let you peruse that later if you wish. These are just a few of possible reasonable accommodations that individuals with mental health conditions might benefit from. There are many. Of course, one of the big emphases of the ADA is individualization, individualized assessment. So each individual, even someone with the same mental health condition, they may require different accommodations for the particular way in which that condition manifests in their lives, or of course with respect to their job and the duties of that job. So the law requires that employers treat them in an individualized capacity. Usually that's done through something called the interactive process, and the emphasis there should be that employers take a problem-solving approach to trying to work with the employee in terms of finding a reasonable accommodation that works for both parties. The defense to a request for a reasonable accommodation is if the employer faces undue hardship. The simple explanation of that term is it means a significant difficulty or expense. I would just note that that significant difficulty or expense is considered relative to the employer. So if it's a very small employer, they don't have a great deal of resources, the limit for ADA coverage is 15, so it would never be smaller than 15 for the ADA to apply. Then that would be considered in terms of assessing, is there an undue hardship? If it is a international corporation with thousands of offices, tens or hundreds of thousands of employees, then that would be a very different assessment in terms of their capacity to meet the request for a reasonable accommodation. As I mentioned, there are limitations built into the ADA to restrict employers' ability to ask for information about everyone's health issues. So this doesn't just apply to people who have disabilities, it applies to everyone in every workplace that has 15 employees or more. So employers can only ask in very particular circumstances questions related to an individual's disability or require medical exams. And this spells out some of those situations and where they can and cannot do so. Similarly, any medical information gleaned by employers in whatever manner is protected under the ADA and should be kept in separate personnel files and kept in a confidential manner, with a few exceptions, such as if someone has requested a reasonable accommodation and they need to let the supervisor know, or they need to let someone else involved in the workplace know so that they'll be aware of that accommodation. If they need to know, on a need-to-know basis. As with every other equal employment opportunity law, the ADA incorporates protections against retaliation. We actually receive at the EEOC more retaliation charges than charges of any other type. So it is not uncommon when individuals come forward and make a claim or even talk about, they think they might have been discriminated against in the workplace, for them to then face retaliation. And oftentimes, in terms of the proximity and time of their making a claim or discussing, potential discrimination with their colleague, it's relatively easy to demonstrate that retaliation or intimidation may have occurred. I wanted to mention a few special topics. One of them is the direct threat defense. That is an ADA defense, and it addresses the question of safety. And I thought it was particularly important to speak with you all about it because, again, there are so many stigmatizing beliefs about individuals with mental health issues, particularly that their presence in the workplace might pose a danger to themselves or to others. The ADA contemplated that. Congress specifically was concerned with mental health issues when they created this direct threat defense, and it contains two required elements that an employer must demonstrate, and they must do so using objective evidence, not simply stereotypes. Or in a case that we resolved that's cited there, this is when a hotel manager let his supervisor know that he needed treatment for depression. He went into a hospital as a patient for 2 days and was fired because his supervisor perceived that allowing him to return would be a threat. So that would not constitute a demonstration of the direct threat defense. Instead, the direct threat defense has two elements. First, a demonstration with objective evidence that there is a substantial risk of significant harm if that individual were to stay in the workplace. And second, the employer must consider, is there a reasonable accommodation that could be provided that would reduce or eliminate that potential safety risk? We put out a piece in May 2022 that's linked to there on artificial intelligence, algorithmic decision-making in the workplace, and issues that arise with respect to people with disabilities. Those, unsurprisingly, can affect individuals with mental health disabilities as well. And it's somewhat complex, so I won't go into it here, but I hope that that may be helpful in terms of just maybe flagging some of those potential issues for you. This is an area where there's a lot of misunderstanding, we find. Substance use disorder. The ADA does not cover individuals who are currently engaging in illegal drug use. However, it does protect individuals who are in recovery and no longer engaging in illegal drug use, and someone who may have completed recovery some time ago. So those individuals are protected, including when they take medication-assisted treatment. We have found in a number of circumstances that learning that someone has been in recovery, learning that someone is taking medication-assisted treatment, seeing a positive drug test for physician-prescribed and administered medication treatment for, say, opioid use disorder, all of those kinds of scenarios on occasion can precipitate termination, discipline in the workplace. But those individuals are protected by the ADA. Now, in some circumstances, there may be a federal law that would prohibit the use of a medication-assisted treatment that may also be an opioid, but a prescribed opioid, in certain very particular job situations that may involve, safety, very serious safety concerns. Those would need to be particularized to that specific job. So again, this is, Congress was trying to really narrow the ability for employers to simply rely on myths and fears and stereotypes in the workplace. this is a little bit more on that same topic. And finally, we have tried to just provide materials for mental health providers. As we've already heard, individuals with disabilities often want to go to them for assistance if they're seeking reasonable accommodations. So we have prepared some materials for them to help educate them about how to assist those clients seeking reasonable accommodations, and those are available. And the remaining materials are largely additional resources for you, and I will just be happy to take your questions.
Yeah, if we have a question specifically about EEOC, we can go to that first and then.
Can you tell me if the EEOC applies to children in schools? Because now there's a concern about who's going to be the next mass shooter, and kids are retaliated against, and what is their protection?
So I don't know if I fully understand the question, but the basic answer is no, it does not. The ADA has various titles. The employment provisions are under Title I of the ADA. Other titles could address some scenarios there, as could the Rehabilitation Act of 1973. So those would be other federal agencies that would address those issues.
I believe the EEOC workplace harassment guidelines that came out earlier this year included for the first time remote work and guidelines around that. And I was wondering if you could just speak a little bit more to that, because I think in a lot of instances, remote work and hybrid work, flexible work, as you indicated, is looked at as a way to, address and better support mental health issues. But there are certainly things to be aware of there in terms of, inclusion and exclusion for employees who are working remotely and how that can impact their mental health. So I was wondering if you could just speak more to that in our new world of work.
Certainly. So just one important note, employers cannot unilaterally impose accommodations on individuals. I wasn't quite sure what you were suggesting there, but if you were suggesting that some might be trying to exclude someone from the workplace by imposing telework on them without them having requested it, that would not be appropriate under the ADA. But with respect to general considerations of telework, I will say that, we all have lived through a pandemic during which there was a massive adoption of telework. And that we consider sort of as, as a very helpful demonstration in many circumstances of the efficacy with which individuals can complete their essential job functions through telework. So, as I say, every assessment would be an individualized assessment, but that kind of experience, if a particular employer had spent years having the vast majority of the workforce work off-site successfully, that would certainly be a consideration in terms of the practicability of providing reasonable accommodation of telework to a particular individual.
So I know that the EEOC has been focusing on mental health related discrimination and disability discrimination. And as you noted, you've obviously seen this increase in charges. And I'm curious if you have a sense of what's driving that. I mean, are more people filing charges? Has the nature of the discrimination changed? I just find it interesting because employers are talking more and more about mental health in the workplace, but at the same time, you're seeing that.
I do not know why. Really can't speak to it. I'm hoping perhaps my co-presenters can.
And also, I know that this is a very information-dense presentation, which is wonderful because there's lots of links that you guys can follow and get the exact info on. So we will be providing that. So don't feel like you have to write all that down.
Great. Hi, everyone. I'm Dr. Jason Wang, or Wang, either way. And I am primarily a DC psychotherapist here. One specialty that I have that I like to work with specifically is career issues and mental health. So that's a big part of my clinical practice. So I see a lot of individuals with all sorts of issues with DC. Burnout is a big one, meaning in work, future career, change in career, and unemployment is a big one. And so my research base is actually more on the unemployment side. So I want to talk about that and how it relates to our topic today. So my research subspecialty is known as vocational psychology. So those of you all who work at the intersection of career and mental health probably know more about IO psychology, industrial organizational psychology. And to differentiate a little bit, IO psychology focuses on workers and psychology, workers in psychology in the context of their organizations. Vocational psychology, which I'm interested in and is my research base, is more about workers across their career lifespan. So across different organizations, jumping jobs, jumping organizations, selecting a career to begin with. All of that is more squarely in the subfield of vocational psychology. So is unemployment. If you think about it, IO Psych, again, is not only funded a lot by organizations and companies and whatnot, but is concerned about workers in the context of their organizations. What if they're not in an organization? What if they're unemployed? What happens? So again, that's a little more the realm of vocational psychology, which is interested in the career lifespan. And more these days, it's very, very normal to have a period of unemployment, particularly over the course of the past 20 years with, the Great Recession and then the COVID period. A lot of folks in particular, unemployment numbers just spiked, particularly during COVID. So it's a really important topic that is underfunded, underconsidered, and is very much a part of the intersection of work and mental health, but just doesn't get enough attention. It's also important to this topic in particular because it is folks, people of color, as well as people from low socioeconomic status households tend to be disproportionately, their unemployment numbers are disproportionately high compared to other populations. And so it's a particularly important topic as well to look at. And the stigma, I think, is twofold as well with unemployment. The first part of it is mental health and work in general. Like that intersection is very stigmatized and hard to talk about oftentimes. And then being unemployed, particularly the longer you are unemployed, after 2-3 months, it becomes very stigmatizing to talk about that too. There are a lot of assumptions out there about, why are you unemployed for this long period of time? There must be, the assumptions and the stigma can be, there must be something wrong with you, or maybe there's a reason you're unemployed, or maybe you just haven't searched hard enough. And that's all really damaging and really far from the truth in most, if not all, cases. So unemployment and mental health is a realm that just really doesn't get enough attention. It's also pretty clear that unemployment is very much negatively associated with mental health. So there are meta-analyses out there. Paul and Moser did a really important one in 2009 that found meta-analyses of different studies for like decades. I think they did this analysis of that unemployment is associated with higher anxiety, higher depression, higher distress and stress, as well as higher self-esteem issues. And all of that makes sense, right? And in my clinical work, I see all of that too. And there are different shades of unemployment that are even more important to consider. Like unemployment numbers are, the definition of unemployment in the US at least is you have to be, you have to not have a job, you have to be looking for a job, and you have to be available for a job. And so that leaves out folks who, for example, are forced into retirement. That's been happening a lot post-COVID. And I have a client right now who basically lost his job and is contemplating early retirement because can't find a new job. It also refers, of course, to folks who are not in the workforce and looking for a job because they're caregivers or they have other jobs at home, caregiving, being a parent, and all of that. And all of that is also underreported and underconsidered as well, and disproportionately affects communities of color as well as those who are from lower socioeconomic status households. So it's a really important topic that doesn't get a whole lot of attention, I would say. Long-term unemployment in particular, which is defined as 27 weeks. And I think COVID really highlighted this. A lot of folks became long-term unemployed during COVID. And even if folks weren't, at the start of COVID, before we knew how long the pandemic would last and how long people would be furloughed and laid off for, everyone was staring at long-term unemployment. We didn't know how long it would go. It was like or indefinite unemployment. And so this is a subsection of the unemployed population that doesn't get a lot of attention as well. About 1 in every 5 folks who are unemployed are long-term unemployed, meaning they've been out of a job for 27 weeks or longer. And that's during what I would call quote unquote normal times. During the recession, during COVID, it peaked at 40% of unemployed folks were long-term unemployed. And you just don't hear about this because there's just so much stigma around admitting that you've been unemployed for more than 6 months. Let's see, what else do I have to say about this? The other thing that is a little bit clearer with those who are blue collar workers is not only, and this is what the research has demonstrated, is that not only are blue collar workers, which is one way of measuring socioeconomic status, disproportionately affected by unemployment in terms of the numbers are higher proportionally, but also that their mental health is measured as worse. Like when they are unemployed, blue collar workers in particular, it affects their mental health worse than for white collar workers. And I think that speaks to a few things in our society as well. A lot of blue collar jobs, when they get replaced by automation or something else coming on, it's not only their job that's been eliminated in their company, but it's being eliminated across an industry sometimes. And so it can affect people's mental health even more than just a regular white collar job, for example. You can also look at unemployment by industry, and socioeconomic status can be measured by income, by educational levels, and by industry. And the top industries that have the highest rates of unemployment are, I believe, leisure and hospitality, what's often known as pink collar jobs, followed by construction, and I think there's one other one that is more of a considered a blue collar occupation. So again, it's disproportionately affecting marginalized communities and communities that are less privileged. So these are really important things to be aware of. All right, I think I'll leave it there for now. See if we have any questions.
And if you have questions, just wait for Maddie to get the mic to you, please.
How do these unemployed patients even come to you and afford you?
Yes, and that's very fair. And it's true that at least in my clinical practice right now, I'm seeing folks who have more means right now because they're able to come see me. They have more means, but the depths of how much unemployment still can really mess up their psychology and really, that's not a very clinical word, mess up their psychology. How much unemployment can affect them is quite strong, considering that they have financial means and are, for the most part, financially secure. You have to be relatively financially secure in order to see a psychologist while you're unemployed. And that tends to be true. But even so, and that's why, it can be doubly, if you're less privileged and you have, and you're financially insecure, that just really adds to all the pressure, for sure.
I was just wondering, are you aware of any states or private companies that are offering mental health services to unemployed individuals? Like, is there anyone doing anything innovative on this?
Do you want to take this? Go for it.
Yes, so in my practice, I get referrals from the Division of Rehab Services in Maryland. I have a contract with them, and so these individuals are unemployed, they're looking for work, they either have physical or they have mental health disabilities. And so DOORS will refer them to me for supported employment, where I assist them with finding work. And the work that I help them find, it must meet their ability to be able to prepare for, obtain, and maintain suitable and gainful employment based on their disability. So for instance, if I have someone who, many of the individuals I work with are blind or visually impaired, I need to make sure that the role I put them in matches their abilities. And so for instance, I've had a registered nurse that I've worked with who went blind later in their life. And so they could not return to being on the floor as a direct care RN. And so I was able to help them find a job in insurance where they were able to use JAWS, which is a voice activated software program, for them to be able to do their job through the insurance company and do clinical supervision in that role. And so DOORS assists with that. Also, other agencies like the Developmental Disabilities Administration, they will send individuals who are employed as well if they have a disability. Doesn't necessarily have to be a mental health disability. It just could be like a back injury. But, it just really just depends on the criteria that's being met.
Sabrina, you spoke about the stresses that folks from lower socioeconomic backgrounds face in the workplace, and I'm wondering if you can elaborate on solutions for those individuals, given what a breach of privacy it would be to ask directly if someone's facing those kinds of stressors, and that a lot of folks probably aren't comfortable speaking about it, even if they are asked. So just wondering if you can elaborate on solutions there at an employer level.
Definitely. So there are some employers who are implementing programs where people can get their paycheck early. And so, or they can get in advance, because there are many individuals out here who are earning, $15, $16 an hour, and they're working full time and they're living paycheck to paycheck. And so if they're living paycheck to paycheck, more than likely they don't have good credit. They're behind on bills. They've probably maxed out credit cards. And so they're sitting at work sometimes trying to figure out, how am I going to have money to get gas to get home, or be able to put money on my card to be able to get home using the metro. And so employers are doing cash advances. Also, some employers, they provide a benefit where their employees can get reimbursed, or they get a stipend for the metro or for the bus system so they can get full work. So when thinking about the benefits that employers are creating outside of insurance, outside of a 401k, making sure that you are having things that can be beneficial for your employees to help make it easier for them to be able to get to work and from work. Also, fitness. Fitness is very important. There are individuals who, they're working 40 hours a week, then they have to go home and they have to be able to take care of their children, do homework, and all the other tasks that they have to do. And so, implementing something as simple as being able to take 30 minutes or an hour a day to be able to go and walk outside, or use some fitness facility nearby that is comped into their benefits. That can increase mental health so much by being able to just be able to have that time to work out, to be able to go outside. Other things that some employers are doing as well, making sure that they are providing free mental health services to their employees. Some employees are very hesitant to use those benefits from employers because they're worried about the employer finding out that they're using those benefits, and they think that could impact promotion. So when I'm talking to employers or consulting with them about, creating their practice, just saying, making sure that you're partnering with outside entities that are not associated with the company. Like if you're, I'm in the therapy world. And so therapists with our benefits, we're able to offer these benefits. Well, I'm not going to want to use our counselors to be able to provide mental health services to our individuals. So let me partner with another agency that I know of so they can see my employees, and then perhaps my agency will see their employees, and we have that partnership and work together.
I was wondering, Sarah, I think you said that the EEOC receives more retaliation claims than any other kind. Has that increased over the years? And also, do you happen to have a percentage on how many of those are resolved in the favor of the employee?
I do not know them offhand, but they are all available on the website at the link that I gave you. I'm not aware of a significant increase. I think the number of retaliation charges more or less remains steady around 30% and above.
I know over the past few years, a lot of corporations have said that they're more interested in this work and more interested in reducing bias. How much of that, in each of your perspectives, is really actionable and has made a big impact, and how much of it is just sort of, lip service?
Actionable, it is definitely you can definitely do it, and it can be successful. I find that the companies that are successful in reducing discrimination and bias, they put it into practice. It's more than lip service. It's more than having it written down in a policy, or doing the annual training on DEI. And a lot of companies are changing the name of that because it's such a hot topic phrase right now. So they're calling it inclusion training for many of the agencies, but it's essentially DEI. And so, making sure that you're putting into practice, making sure your leadership is representative of the clients you're serving and also the employees, making sure it's really diverse. It's one thing to say that we are diverse and inclusive, but you should be able to actually see it in practice. So practice is number one. And then secondly, making sure that you're consulting with others who have done it successfully. I find that many employers, they have their checklist and they'll just check off, okay, we did our training, we got our CEs or CEUs, but making sure that you are collaborating and doing a continuous evaluation and a needs assessment, reevaluating, giving out surveys and saying, is this effective? And making sure that it is confidential so the employees will feel like they can truly speak up without being penalized. So yes, it can be done. And the other part of that question you asked is, are corporations actually doing it? I do think some are doing a good job, but then there are others where there's a room for improvement.
Let me take that one as well really quickly. This is not my necessarily research specialty, but I know there's been a lot of the psychological research on things like implicit bias training and whatnot has really matured. And what we found is that it's more complicated than initially thought. So for example, studies that first looked at implicit bias showed that doing a training would reduce the implicit bias people would show up on implicit bias tests if they were, if they took the test before and then the training and then after. And this was done in a research setting. I think more research has come out that shows that effect lasts for a few hours to a couple days if it's not reinforced in different ways, if it's not done in a specific way. So there's a lot of ways in which it can be checkboxy. And if it's just a one, special day over the course of, 365, then it's definitely not going to do much good. But I would say the research has really matured. So there's a lot more there that can guide folks on how to do this in a way that's lasting and meaningful. And I'm not sure companies are paying attention to that quite as much.
And just, I know you had asked for all of us to offer comments. I don't have a comment with respect to your core question, but I would say, what we see over time is that just baseline training on EEO laws is often could be very helpful in terms of just that aspect of just understanding what is discriminatory conduct in the workplace. For example, what is harassment in the workplace, which our very recent enforcement guidance addresses, and then how to understand when that occurs, what are appropriate responses to it with respect to the EEO laws.
I have kind of a random question for Jason. I was wondering if you had any opinions on UBI and if decoupling work from money could then change the way unemployed people see themselves.
Sorry, could you say that again? If decoupling,
work for if guaranteed income was a thing, do you think unemployed people would not feel so bad about being unemployed? Because then we wouldn't be connecting money and work.
I think certain things would be better for sure. I mean, financial stress exacerbates everything, but I think we are a culture of that prioritizes and exalts work, so that if you are not working, so for example, in some of the more privileged clients I see, they still feel unseen by society, and useless is a word I hear a lot, and unwanted is a word I hear a lot. And so that part of it is really hard to get rid of because of the culture that we have. There's one journalist who's wrote an interesting thing about our relationship to work. There's been a series of studies that talked about our relationship to work, and split it into three different types of relationships to work. We can either see our work as a job, we can see it as a career, or we can see it as a calling. And I think these days it's definitely shifted as a culture towards seeing work as a calling. It has to be meaningful, it has to be socially useful. And so when we don't get those things, then we're missing a calling in life. And so that's a really big deal. The journalist I was talking about has actually, his speculation is that calling is a religious term. It's like you're called to serve God in a specific way. And as organized religion has decreased in the U.S., his correlation that he sees is that work as a calling has increased in the U.S. So we've literally replaced, religion with work, as work is our national religion in a lot of ways. And so it is about so much more than just the finances. But would decoupling it from finances help? Yeah, absolutely.
This is a question for all of you. Is there something that comes up in your work that surprises you or you wish more people knew about?
For me, every day, I, again, work with people, or part of my practice, who are blind and have visual impairments. So the assumption is that when I'm going to employers and saying I got this amazing candidate and they find out that they're blind, oh, I can't accommodate them. How are they going to do the job? And so it's a lot of education that I have to do with employers. But the thing that shocks me every time is when I have someone who is a severe case. For instance, I had someone who was totally blind and they were able to get a job in a retail store, working the cash register. They were able to accept money, and they were able to stock and tag and actually worked up to manager at the retail store. But if you have the supports, which the Division of Rehab Services provides, they have those, they do workplace assessments. There are rehabilitation engineers who will go in there and they will say, okay, what is it that we can do to make this workspace accommodating? And it can be something as simple as, okay, when the cash register opens, putting braille tabs on there to show which ones is the 5s, the 10s, the 20s, and so on. And then having something as simple as an OrCam, assistive technology device, that they can scan the money. And they'll tell them, okay, it's $5, or this is $10, so they can give back correct change. They get extra time as a part of their accommodation to carry out their duties, but it can be done. And when I see them go from the state of depression, because they're receiving Social Security SSI or SSDI benefits every month, and if you're getting SSI, you're not getting any more than $900, and I think it's like $73 a month. It may be a little bit over than that, and you're sitting at home watching TV all day, feeling worthless because society has told you you can't do anything, and then you get to this point where you are now a manager at a retail store or even a government employee, which I've had happen as well with Social Security. It changes their life. It changes their mental health. I've had some who have come off of their medication for depression because they have, as Jason was saying, self-worth. They have a purpose. They have a calling. So that is what surprises me, doesn't surprise me, but still surprises me every time it happens. Yes.
Yeah, I would say it both surprises me and doesn't surprise me at how closely mental health, how much mental health can deteriorate as a result of being unemployed. Folks who have absolutely no history of mental health issues can suffer greatly as a result of unemployment, especially if it lasts a long time. My training is not. My training does not emphasize diagnosis. It emphasizes context and identity and everything that goes on about you that causes you to have the issues that you have at this moment in time. And I think that's the right approach for folks who are unemployed, because it's our society, it's the stigma, it's that makes us feel so terrible about ourselves and really drags down our mental health. The research shows that when you regain a job after a period of unemployment, your baseline mental health jumps up to higher than it was when you lost a job. That's just how important being employed can be overall to us as a society.
just reiterate a point that I flagged in the presentation, that I find it surprising that there continues to be so much stigma about mental health in the workplace, and actions occur in the workplace that are unrelated to, you know, the actual performance of the individual, the actual capability of the individual, with oftentimes these presumptions of risk or danger simply by virtue of a diagnosis.
I have questions for Sarah and then also the doctors. So first, and I apologize if this was in the slides and I missed it, how is it determined which mental illnesses are covered under ADA? Is it what's in the DSM-5? Is it, I mean, how is that determined?
It's not what's in the DSM-5.
I figured.
It's the that analysis with the guidance offered by the ADA Amendments Act of 2008, going to that basic definition. Is there a physical or mental impairment that substantially limits a major life activity, including a major bodily function? And that's really very individualized. I will say, however, we've identified in our regulations some conditions that we call predictable assessments. And those are conditions that are very, very likely to, you know, be considered disabilities in virtually all circumstances, which would indicate they would require a very limited individualized assessment. Those include some very common mental health issues like major depression, schizophrenia, OCD, and PTSD.
Mm-hmm. And what about ADHD in there? Is that in there or no?
ADHD is also referenced, and the same analysis would apply.
Thank you. And for you all, I mean, one thing that's come up a number of times in our earlier sessions is talking about how, you know, finding a therapist that, you know, takes your insurance or something along those lines is difficult enough. But as we know, it's really important to find a good fit. So I was wondering if you could speak to, you know, the limitations, the shortage of therapists of color and how that plays into folks who are needing help with workplace issues or personal, but.
Yes. So for therapists of color, one thing, we're still recovering from COVID.
Yeah.
Many of our students were not able to get their clinical hours during COVID. And so with that, there was a setback with graduation dates, also people dropping out of programs. So we're still trying to recover, as well as nursing and many of the other career fields that were impacted by COVID. Specifically for persons of color, what I have seen from, you know, just the workshops and the conferences and the conversations I've had with counselors of color, first off, they are oftentimes, they have too many clients already. They are already overbooked. They can't accept new clients. And that is for those who are fully licensed and also for those who are associate counselors working towards getting their full clinical supervision hours. So that's one thing. And then the other aspect of it is accessibility. There are certain areas where you have more therapists of color. So some may not do teletherapy. So if you're living in a very rural area, you may not have any therapists of color in that area. The small town that I am from in North Carolina, they don't even have a therapist who is in private practice. Everyone has to go to the Department of Social Services or Behavioral Health. And then when they do meet with a therapist, it may be for 10 minutes because their caseload is 50 or 60 a week that they're seeing. So they're not even getting the full hour. So there are a lot of different factors as it relates to that. You know, also a lot of persons of color who are fully licensed are moving to private practice because of the demands of insurance and all of the reporting that you have to do for Medicaid and the other insurance agencies that are out there. So because of that, and where there have been times where there have been system changes as far as payment being received from Medicaid and the other insurance companies, it may be 60 days, it might be 90 days before they receive payment. The system was hacked. Was it a month or two ago? And so we had many therapists who did not get paid. They couldn't meet payroll. And we've had that happen in the past. And many say, you know what, I'm done with accepting insurance because I can't make a living to cover my payroll. I can't make a living to be able to pay my bills. And so they're moving to private practice because more flexibility. You have the ability to be able to bill higher, maybe at $200 an hour. So you may only need to see 10, a maximum of 20 clients a week compared to 40 or 50 you were previously seeing doing insurance. So those are some of the factors impacting, I would say, persons of color from conversations that I've been a part of.
Yeah, I would second all of that. I think one note of hope is I'm seeing in a lot of programs, particularly ones that are a little more social justice oriented, so less in the clinical psychology space, more in counseling psychology, and a social work space. There's more interest and real commitment to social justice in terms of the cohorts that they're bringing into these programs. So it's going to be a little while, but I'm seeing more and more cohorts of therapists of color coming out, and that's a promising sign.
Well, hope is always a nice place to end on. So thank you so much.